The 3-minute exercise that saves lives after a stroke. Every senior should know a stroke occurs when blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Within minutes, brain cells begin to die. There are two main types of stroke. Ischemic stroke, which account for nearly 87% of all strokes, is caused by a blockage in an artery supplying blood to the brain. Hemorrhagic stroke, on the other hand, result from a blood vessel rupture, leading to bleeding in or around the brain. After a stroke, the effects can be life-altering. Many seniors experience weakness or paralysis on one side of the body, difficulty speaking, problems with coordination and balance, and changes in memory or thinking. These effects vary depending on the location and severity of the stroke. For many, simple daily tasks such as standing, walking, or dressing become major challenges. Rehabilitation after a stroke is essential and time-sensitive. Research has shown that the brain is most receptive to recovery during the first 3 to 6 months following a stroke. This is due to a phenomenon called neuroplasticity, the brain's ability to reorganize itself by forming new neural connections. Through targeted activity and repetition, undamaged parts of the brain can take over functions that were lost. Without early movement and therapy, the risk of complications increases. These complications can include muscle stiffness, joint pain, pressure sores from immobility, and even pneumonia or blood clots. In severe cases, lack of rehabilitation can lead to a permanent loss of function, reducing the individual's quality of life and increasing their dependence on caregivers. According to the World Health Organization, stroke is the second leading cause of death and the third leading cause of disability worldwide. Among older adults, stroke-related disability significantly raises the risk of falls, hospitalization, and early institutionalization. However, consistent physical activity, even in short, structured intervals, has been proven to reduce these risks and improve long-term outcomes. The key message is clear. Early and appropriate movement after a stroke can save lives, reduce disability, and restore independence. Even just a few minutes a day can make a measurable difference. The body needs movement to stimulate blood flow, maintain joint function, and encourage the brain to rebuild. For seniors, especially those recovering from stroke, a guided exercise routine can be the first step toward regaining control and improving daily life. Physical movement is one of the most powerful tools for stroke recovery. It is not just about regaining strength. It is about helping the brain re-establish lost connections. This is made possible through a process known as neuroplasticity. Neuroplasticity refers to the brain's ability to reorganize itself by forming new neural pathways. When a stroke damages one part of the brain, other parts can adapt and compensate, but only if they are stimulated through repeated, purposeful activity. Scientific studies have confirmed that repetitive movement, even simple motions, activates specific areas of the brain and helps retrain it. This means that exercises performed after a stroke are not just physical, they're deeply neurological. Each movement sends signals that reinforce or create new pathways between the brain and the muscles. The more often these movements are performed, the stronger these pathways become. Short, focused routines are particularly effective for elderly patients. While long physical therapy sessions can be exhausting or even risky for some seniors, brief but consistent exercises are safer and often more sustainable. Researchers have found that even 3 to 5 minutes of targeted movement can improve circulation, reduce stiffness, and stimulate brain activity. In older adults, immobility after a stroke can lead to rapid health decline. Blood clots can form in the legs due to poor circulation. Muscles can weaken within days, and joints can stiffen. Even lung function can be impaired when a person remains inactive for too long. In this context, even a few minutes of movement can prevent serious secondary complications. One study published in the Journal of Stroke and Cerebrovascular Diseases showed that early mobilization and light exercise in the days following a stroke led to significantly better functional outcomes at 3 months. Participants who engaged in short, structured movements had a lower risk of developing complications and were more likely to regain independence. Exercise also has cardiovascular benefits. It helps control blood pressure, improves heart function, and supports metabolic health, all critical factors in preventing a second stroke. In fact, more than 1 in 4 stroke survivors will suffer another stroke if preventive steps are not taken. Simple daily exercises can reduce this risk by improving overall vascular health, in addition to physical benefits. Movement has psychological advantages. Depression and anxiety are common after a stroke. Gentle exercise stimulates the release of endorphins and promotes a sense of accomplishment, which helps support emotional recovery. For elderly patients, who may also struggle with isolation or loss of autonomy, even a brief routine can restore confidence and a sense of control. The science is clear. Movement is medicine after a stroke, and the earlier it begins, the more powerful its effects. A short, consistent exercise routine, even as little as 3 minutes, can activate the body, awaken the brain, and start the process of recovery. The 3-minute exercise routine designed for stroke recovery in seniors is simple, safe, and effective. It focuses on restoring circulation, improving mobility, and stimulating brain activity. Each minute targets a different part of the body to encourage balanced engagement without causing fatigue or stress. This routine can be done seated or standing with support, making it accessible even to those with limited mobility. Minute 1. Seated marching. Begin with a seated position in a sturdy chair, feet flat on the floor and back straight. Slowly lift one knee toward the chest, then lower it and lift the other. Continue alternating legs in a steady, marching rhythm. This exercise strengthens the hip flexors and thigh muscles, stimulates circulation in the lower body, and promotes blood flow to the brain. It also helps retrain the brain to control leg movements through repetitive action. The key here is rhythm and repetition. Aim for a slow but consistent pace, lifting each leg as high as is comfortable. Seniors who can stand safely may choose to do this while holding onto a stable surface like a counter or chair back. The movement mimics walking and helps maintain coordination and balance, critical functions that often decline after a stroke. Minute 2. Arm raises and shoulder rolls next. Engage the upper body. While seated or standing, slowly raise both arms forward to shoulder height. Hold for a second, then lower them gently. Repeat this motion several times. If mobility is limited, raise one arm at a time. This exercise strengthens shoulder and upper back muscles and encourages joint flexibility. It also improves posture, which can decline in stroke survivors due to weakness or immobility. After several arm raises, transition into shoulder rolls. Gently roll the shoulders forward in a circular motion for a few seconds, then reverse the direction. This movement eases muscle tension and improves range of motion in the upper body. It also supports the activation of neural circuits involved in motor control, especially for those regaining coordination after a stroke. Minute 3. Deep breathing and neck stretches. The final minute focuses on breathing and gentle stretching. Inhale deeply through the nose, hold for a moment, and exhale slowly through the mouth. Repeat this cycle several times. Deep breathing helps oxygenate the brain and relax the nervous system. It also promotes lung expansion, which can be reduced by inactivity after stroke, while breathing deeply adds slow neck movements to the routine. Gently tilt the head to the left, return to center, then tilt to the right. Repeat a few times. Follow with slow turns of the head from side to side, keeping the shoulders relaxed. These stretches reduce tension in the neck and upper spine and support better circulation to the brain. This final minute encourages relaxation, reduces stress, and promotes mindfulness, all of which are essential in stroke recovery. It also improves flexibility and posture, which contribute to overall safety and function in daily life. When performed daily, this 3-minute routine becomes a powerful tool in stroke rehabilitation. It activates major muscle groups, encourages brain-body connection, and supports physical and mental recovery. For seniors, this simple practice can make the difference. Regularly performing this 3-minute routine can lead to measurable improvements in the health and function of stroke survivors, particularly seniors. The body responds to consistent movement with better circulation, improved joint flexibility, and stronger muscles. But beyond the physical gains, these simple exercises offer neurological and psychological benefits that contribute significantly to overall recovery. One of the most important results is improved blood flow. After a stroke, many seniors remain sedentary for long periods, increasing the risk of deep vein thrombosis, pressure ulcers, and poor oxygenation of tissues. Gentle movement, such as seated marching or arm raises, stimulates the heart and helps maintain healthy circulation throughout the body. This reduces the chances of blood pooling in the legs and lowers the risk of additional vascular complications. Muscle strength and joint mobility are also positively affected. When muscles are not used, they weaken quickly, especially in older adults. The seated march targets the legs and hips, which are crucial for balance and walking. Arm movements improve upper body strength and coordination, allowing seniors to perform daily tasks like eating, dressing, or reaching more independently. These exercises also prevent joint stiffness, which can become painful and limiting over time. Another key benefit is the stimulation of brain activity. Every time a person performs a controlled movement, especially after a stroke, the brain is forced to engage in planning, coordination, and motor control. These actions promote neuroplasticity, the brain's ability to adapt and rebuild connections. Over time, these repeated movements can improve the brain's ability to send signals to affected limbs, gradually restoring function. Many seniors report enhanced balance and confidence after adding daily short exercises. The movements used in this routine mimic functional activities such as walking, standing, or turning. Practicing these motions regularly strengthens the connection between the brain and body, reducing the risk of falls, which are a major concern in post-stroke elderly populations. Improved balance also means more independence and less reliance on mobility aids or caregivers. From a psychological perspective, engaging in even a short, structured activity provides a sense of purpose and progress. Depression and anxiety are common after a stroke, often made worse by feelings of helplessness. The act of moving, even for 3 minutes, gives individuals control over their recovery. The routine becomes a daily habit that fosters consistency, resilience, and a focus on improvement. In clinical settings, therapists have noted that patients who begin light exercises early in their recovery show faster gains in mobility and quality of life. A case review from a geriatric rehabilitation center revealed that patients practicing daily short routines were more likely to transition back to independent living compared to those who remain inactive. The results are clear. This 3-minute routine is not just a set of exercises. It is a powerful rehabilitation tool that improves physical function, supports brain recovery, and restores confidence. For seniors recovering from a stroke, these daily movements can transform a difficult recovery into a hopeful path forward. While the benefits of the 3-minute stroke recovery routine are clear, it is important to ensure that seniors perform these exercises safely and consistently. Safety begins with timing. The best time to start any physical movement after a stroke is as early as medically allowed, typically within a few days, depending on the severity of the stroke and guidance from healthcare providers. Early mobilization has been linked to better outcomes, but it must be approached with care to avoid overexertion or injury. Before beginning the routine, seniors should consult with their physician or physical therapist. A medical professional can evaluate their current physical condition, balance, blood pressure stability, and muscle tone. This step is especially critical for individuals with other health conditions such as heart disease, arthritis, or uncontrolled diabetes, which may affect how they tolerate certain movements. For added safety, caregivers or family members should be present during the exercises, especially in the first few weeks. Having someone nearby provides emotional reassurance and immediate support if balance is lost or fatigue sets in. In some cases, therapists may recommend using assistive tools like resistance bands, stability chairs, or walkers to enhance safety and control. Consistency is just as important as safety. The effectiveness of this routine depends on repetition. Performing the exercises once a week will not yield the same results as doing them daily. Seniors should aim to complete the 3-minute routine at least twice per day. The simplicity of the routine makes this goal realistic. Even for those with low energy levels or physical limitations, one effective way to build a habit is by linking the routine to daily events. For example, it can be done before breakfast and again in the early evening. Setting reminders on a clock, phone, or using sticky notes can help seniors remember to complete the routine. Some find it helpful to play a favorite song or use a calming timer to make the practice more enjoyable and structured. Motivation is another key factor. Caregivers should encourage progress, no matter how small. Tracking improvements, such as increased leg lift height or longer duration without fatigue, can help maintain a positive outlook. Many seniors feel more engaged when they understand that their efforts are producing results. Sharing progress with a healthcare provider also reinforces the importance of consistency and can guide further adjustments to the routine. For seniors in community centers or group homes, incorporating this routine into a group setting can provide social interaction and increase compliance. Group exercise promotes shared motivation and accountability while also reducing feelings of isolation that often follow a stroke. In summary, the success of this routine relies on safe practice, early start, and daily repetition. With proper support and structure, it becomes a simple but powerful part of a senior's daily life. For stroke survivors, this routine is not just exercise. It is a lifeline to recovery, stability, and regained independence.